What's happening, everyone? Dr. Elena Morrison here from Senior Health Tips, and today I need to tell you about something that might be in your refrigerator right now, something 78% of American men drink every single morning, something the dairy industry has spent billions telling you is essential for bone health. But what they don't tell you is this: for men over 60 with prostate cancer or at high risk for it, this healthy breakfast staple may be directly feeding tumor growth. I'm talking about milk, specifically whole milk and high calcium dairy products. Now, before you click away thinking, here's another doctor trying to take away my food, let me be very clear. I'm not here to sell you fear. I'm here to give you power. Because the science linking dairy intake to prostate cancer progression is not internet folklore. It's peer-reviewed research from Harvard, from Loma Linda University, from the American Journal of Clinical Nutrition. And by the end of this video, you'll know: number 1, the exact mechanism, how milk and dairy accelerate prostate cancer at the cellular level. Number 2, which dairy products are the worst offenders and which ones might be safe. Number 3, the prostate cancer warning pattern doctors look for, symptoms that mean you need imaging this week, not eventually. Number 4, the exact dietary swap that could cut your progression risk by 62%, backed by data from nearly 4,000 prostate cancer patients. And number 5, the complete action plan, what to eat, what to avoid, and what tests to request, so you stop guessing and start protecting yourself. Stay with me until the end, because I'm going to give you a simple protocol you can follow starting today, whether you're newly diagnosed, on active surveillance, or trying to prevent prostate cancer in the first place. And if you've ever watched someone you love lose a battle with prostate cancer because they thought diet doesn't matter, you already understand why this conversation is urgent. Now let's get into it. The breakfast ritual that may be feeding cancer cells. 78% of American men over 60 drink dairy milk regularly. For most, it's automatic: coffee with milk, cereal with milk, a glass of milk for calcium. And for decades, we've been told this is healthy. Milk builds strong bones. You need calcium. Low fat is better. But here's what the dairy industry doesn't advertise. Research from Harvard's Health Professionals Follow-Up Study, tracking nearly 4,000 men with prostate cancer over 8 years, found something alarming. Men with the highest intake of whole milk had more than double the risk of lethal prostate cancer compared to men who avoided it. Not a little higher. Double. Hazard ratio 2.15. That means if you're drinking more than 4 servings of whole milk per week after a prostate cancer diagnosis, you're at a 215% increased risk of progression to metastases or death from prostate cancer. And this isn't an outlier study. A separate study from Loma Linda University, published in the American Journal of Clinical Nutrition, followed over 28,000 men. They found that men who consumed just 1 3/4 cups of milk per day, that's 430 grams, faced a 25% increased risk of prostate cancer compared to men who drank almost none. And here's the part that should make you pause. The risk curve wasn't linear. Most of the damage was done by the time men reached just 2/3 of a cup per day. That's less than half a glass. So if you're thinking, I only have a little milk in my coffee, you may already be in the danger zone. The cellular hijacking mechanism. Here's what's happening at the cellular level, and this is critical to understand. Milk doesn't just sit in your digestive system. It triggers a cascade of biological signals that can turbocharge prostate cancer growth through 3 main pathways. Pathway number 1, the insulin-like growth factor explosion. Dairy consumption, especially milk, raises blood levels of a hormone called insulin-like growth factor 1, or IGF-1. IGF-1 is a powerful growth signal. In healthy tissue, it promotes cell growth and repair. But in cancer tissue, it becomes a problem. Because IGF-1 is both mitogenic, meaning it stimulates cell division, and anti-apoptotic, meaning it prevents cancer cells from dying. Multiple studies confirmed that higher dairy protein intake, particularly from milk, increases circulating IGF-1. And elevated IGF-1 is directly associated with increased prostate cancer risk and progression. So when you drink milk, you're not just consuming calcium and protein. You're sending a growth signal to every cell in your body, including cancer cells. Pathway number 2, the calcium suppression trap. The calcium in dairy products can suppress circulating levels of 1,25-dihydroxyvitamin D, the active form of vitamin D. Vitamin D is one of your body's natural cancer-fighting agents. It can induce differentiation, forcing cancer cells to mature and stop dividing. It can trigger apoptosis, causing cancer cells to self-destruct, and it exerts other anti-cancer effects at the cellular level. But when you flood your system with calcium from dairy, you suppress the very vitamin that's trying to protect you. Pathway number 3, the hormone contamination issue. Up to 75% of lactating dairy cows are pregnant. That means the milk you drink contains naturally occurring sex hormones, estrogens, progesterone, and other compounds from pregnant cows. And prostate cancer is a hormone-responsive cancer. So every time you pour milk into your cereal, you're potentially exposing your prostate to external hormones that can influence tumor behavior. Now here's the checkpoint question. If your doctor told you to avoid a medication that doubled your risk of cancer progression, would you take it anyway? Of course not, but that's exactly what's happening when high-risk men continue drinking whole milk every day. Before I show you which dairy products are safe, which ones are dangerous, and the exact swap that cut progression risk by 62% in a Harvard study, if you're realizing right now how much common nutrition advice is actively harmful after 60, hit subscribe. On Senior Health Tips, I don't parrot industry talking points. I follow the evidence, and I give you actionable protocols you can start today. Not all dairy is equal. Here's where the research gets specific, and this is critical because the dairy industry loves to lump everything together. But the Harvard study I mentioned earlier found something surprising. Not all dairy is equally dangerous. Let me break it down. The danger zone. Number 1, whole milk, hazard ratio for lethal prostate cancer. 2.15, more than double the risk. Men consuming more than 4 servings per week had the highest risk. And remember, the Loma Linda study showed most of the damage happens at just 2/3 of a cup per day. Why whole milk is the worst? High saturated fat content, which may promote cancer progression. High levels of IGF-1 raising compounds. Full hormone content from lactating cows. Number 2, full fat dairy products. This includes cream, sour cream, ice cream, cream cheese, butter, and regular, non-low-fat cheese. The Harvard study found a hazard ratio of 1.30 for men with the highest intake of full-fat dairy. Not as extreme as whole milk, but still a 30% increased risk. The safer zone. Low-fat and non-fat dairy. Here's the surprising finding from Harvard. Men with the highest intake of low-fat dairy products had a 38% lower risk of lethal prostate cancer. Hazard ratio, 0.62. This category included skim milk, 1% and 2% milk, low-fat yogurt, cottage cheese and ricotta, low-fat versions, and low-fat cheese. Now, the researchers note this finding should be interpreted with caution because it could be a marker for other healthy lifestyle behaviors. The trend wasn't perfectly consistent across all consumption levels, but the key takeaway is this. Low-fat and non-fat dairy are not consistently associated with bad prostate cancer outcomes. So for men with prostate cancer, dairy doesn't need to be avoided entirely, but whole milk and full-fat products should be eliminated or severely restricted. What about cheese and yogurt? The Loma Linda study found no significant associations between cheese or yogurt intake and prostate cancer risk. That doesn't mean they're free, but they appear less problematic than milk itself. Let me tell you about a man I'll call Robert, 68 years old when diagnosed with prostate cancer. Gleason score 7, PSA 12, localized disease, good prognosis with treatment. He chose active surveillance, monitoring rather than immediate surgery or radiation, and his doctor told him, watch your diet, stay healthy. So Robert did what he thought was right. low-fat everything. Skim milk every morning with oatmeal, low-fat yogurt for snacks, heart-healthy choices. He avoided red meat, he exercised, he took his vitamins, and for 18 months his PSA stayed stable. Then it started creeping up. 12.3, 12.8, 13.5. His urologist recommended a repeat biopsy. The Gleason score had progressed to 8, and when Robert asked what happened, I did everything right, his doctor paused and said, "Tell me about your diet." Robert listed it all, and when he mentioned the skim milk, every single morning, plus yogurt, plus low-fat cheese, his doctor said something Robert never expected. That might be part of the problem, because even though Robert had switched to low-fat, he was still consuming high volumes of dairy. 1.5 to 2 cups of milk per day, yogurt at lunch, cheese at dinner. Total dairy intake, well over 3 servings per day, and the research is clear. Even low-fat dairy, when consumed in high amounts, can still raise IGF-1. Robert made the switch. He eliminated all dairy milk, switched to unsweetened soy milk and oat milk, cut cheese down to twice per week maximum, focused on plant-based proteins. 6 months later, his PSA stabilized. 12 months later, it started trending down. And when they did another biopsy at 2 years, his Gleason score had not progressed further. Now listen, I'm not telling you Robert's story to promise you a miracle. Individual cases vary, but I'm telling you this because the most dangerous belief in medicine is, what I eat doesn't matter. Because it does. Here's your action plan, and I want you to follow this in order. Step number 1, eliminate the high-risk dairy. Remove from your diet immediately. Whole milk, any amount. Cream, half and half, sour cream. Ice cream, especially full-fat cheese. Butter, switch to olive oil or plant-based spreads. Step number 2, limit even safe dairy. If you choose to keep low-fat dairy, maximum 1 to 2 servings per day total. Focus on fermented options like low-fat yogurt or kefir, may have probiotic benefits. Avoid protein-fortified dairy products. They may raise IGF-1 even more. Step number 3, make the dairy-free swap. Replace dairy milk with unsweetened soy milk, rich in protective isoflavones, may have anti-cancer effects. Oat milk, creamy texture, good for coffee. Almond milk, low calorie. Research shows it suppresses prostate cancer cell growth by over 30%. Cashew milk, rich, neutral flavor. Avoid sweetened versions, high added sugar, and protein-fortified plant milks, unless from whole food sources. Step number 4, prioritize prostate-protective foods. The American Cancer Society and Prostate Cancer Foundation recommend cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, kale, bok choy, tomatoes cooked with olive oil. Lycopene is fat-soluble. Legumes, beans, lentils, chickpeas, high fiber, plant protein, fatty fish, salmon, sardines, mackerel, omega-3s may reduce inflammation. Nuts and seeds, walnuts, flax seeds, chia seeds, plant omega-3s. Green tea, polyphenols may slow cancer growth. Pomegranate, some evidence for slowing PSA doubling time. Step number 5, what to avoid beyond dairy. Processed and red meats, linked to aggressive prostate cancer. High-dose calcium supplements, above 1,000 to 1,200 milligrams per day. High-dose vitamin E and selenium supplements. The SELECT trial linked these to increased prostate cancer risk. Excess alcohol, limit to 1 drink per day maximum. Sugar-sweetened beverages and highly processed foods. Step number 6, monitor and track. Request these tests from your doctor. PSA every 3 to 6 months. Track trends, not just absolute values. Free PSA percentage. Lower percentage equals higher risk of aggressive cancer. PSA velocity. Rate of PSA rise over time. Advanced imaging if PSA rising. Multiparametric MRI or PSMA PET scan. IGF-1 blood test, optional but helpful, to see if dietary changes are lowering it. Vitamin D levels, optimized to 30 to 50 nanograms per milliliter. Now listen carefully, because this could save your life. If you have any of these patterns, you need imaging and specialist evaluation this week, not eventually. Red flag combo number 1, PSA acceleration. PSA rising faster than 0.75 nanograms per milliliter per year. PSA doubling time less than 3 years. PSA rising despite dietary and lifestyle changes. Red flag combo number 2, new urinary symptoms. Blood in urine, hematuria, sudden difficulty starting urination or weak stream. Frequent nighttime urination, nocturia, that's new or worsening. Pain or burning during urination. Red flag combo number 3, systemic symptoms. Unexplained weight loss, more than 10 pounds without trying. Bone pain, especially in lower back, hips, pelvis, ribs. Fatigue that doesn't improve with rest. New erectile dysfunction can be an early sign of progression. Red flag combo number 4, post-treatment recurrent signs. PSA rising after radical prostatectomy, anything above 0.2 nanograms per milliliter, sustained over 2 tests. PSA rising 2 nanograms per milliliter above nadir after radiation. Don't let anyone tell you to wait and watch if you have these patterns. Early intervention changes outcomes. Let's consider a few common questions. Dr. Morrison, what if I've been drinking milk my whole life? Is the damage done? No. The Harvard study looked at post-diagnostic dairy intake and found that men who reduced dairy after diagnosis had better outcomes. Your body responds to what you do now. What about calcium for my bones? I'm on hormone therapy and at risk for osteoporosis. Great question. You need calcium, but you don't need dairy to get it. Excellent non-dairy calcium sources include leafy greens like collard greens, bok choy, and kale. Canned fish with soft bones, sardines, salmon, beans, and tofu, almonds, fortified plant milks, and cereals. Target 1,000 to 1,200 milligrams per day from food. If you can't reach that, discuss supplementation with your doctor, but avoid megadoses above 1,500 milligrams per day. What if my doctor hasn't mentioned diet? Many doctors don't, because nutrition education in medical school is minimal, but the evidence is there. Bring this research to your next appointment and ask, given the Harvard study showing whole milk doubles lethal prostate cancer risk, should I eliminate dairy? That question shifts the conversation. Can I ever have dairy again? If you're low risk, stable PSA, no progression, occasional low-fat dairy is probably fine, but whole milk and full-fat products should stay off the table if prostate cancer is a concern. Now let's talk about timeline and expectations. Week 1 to 2. Cravings for dairy may persist, especially if you've had it daily for decades. Try different plant milks to find one you like. PSA, no immediate change. Month 1. Digestion may improve. Many men have undiagnosed lactose sensitivity. Weight may stabilize or drop slightly. Dairy is calorie dense. IGF-1 levels may start declining. Month 3. PSA trends become clearer. If diet was a factor, you may see stabilization or slight decrease. Energy and inflammation markers may improve. Month 6 to 12. If you are on active surveillance with rising PSA, this is when stabilization or reversal may occur, like Robert's case. Repeat imaging or biopsy, if planned, may show no progression or improvement. Long-term, years, lower IGF-1, reduced chronic inflammation, healthier weight, and better metabolic markers all contribute to reduced cancer progression risk. This is not a cure, but it's a tool that works with your treatment plan to improve outcomes. Final warning. Here's what I want you to remember. The dairy industry is a $60 billion per year business in the United States alone. They have spent decades funding studies, lobbying government dietary guidelines, and advertising milk does a body good. But for men with prostate cancer or at high risk, the science tells a different story, And you deserve to know that story, because unlike cancer genetics, which you can't control, unlike your family history, which you can't change, what you eat is entirely within your power. So here's my challenge to you. For the next 30 days, eliminate whole milk and full-fat dairy completely. Track your PSA, track how you feel, and see if the data speaks for itself. Because I would rather you make an informed choice, even if you decide to keep dairy, than to continue eating something harmful out of ignorance. If this video opened your eyes to how much mainstream nutrition advice is outdated or industry-funded, do 3 things right now. First, subscribe to Senior Health Tips. I'm not here to repeat what you've already heard. I'm here to follow the evidence, even when it's uncomfortable. Second, comment the word dairy-free below, and I'll pin a complete shopping list and meal plan for you. Third, share this with one man over 60, because prostate cancer is the second leading cause of cancer death in men. And most men have no idea that their healthy breakfast might be part of the problem. I'm Dr. Elena Morrison. Your health is your power, and I'll see you in the next video.